All right, so starting Clover's food and water sessions for that matter. I always start her up on the couch like this. Her feeding tube's on her left side, so she's laying on her right side on the couch on some pillows. The first thing I kind of do is push her suit up a little bit to expose the feeding tube button. Take either a gauze pad with some Dawn dish soap or just a paper towel, a wet paper towel, and just gently clean around the area. There's going to be a little bit of discharge, but it's very normal. I typically clean it with Dawn dish soap in the morning and evening, and then during her lunch sessions and during water, just use a wet paper towel. Clean it out a little bit. The feeding tube itself, the button here can wiggle, so I kind of get it. You know, you just have to be very gentle about what you do here, but it does move. Good girl. So clean it up a little bit, and then I'll take the little cover, the piece here that's keeping it closed, and pull it back gently, not tugging on it, but just pull it off so it's exposed here. And take her feeding tube, the feeding tube with water already in it, and then I line up the notch on the feeding tube with the notch in line on the button on her stomach, insert it, and then twist it to the right to lock it in place. And now if you see, I can't pull this out. So to start feeding or anything, you usually flush through a small syringe of water just to get her system acclimated. And then I'll take that off after I've clipped it closed. Take a feeding tube, get the air out of the tip of it. If she wants a little bit, that's okay. Just insert into the end of the tube here. Unclip the white little locking mechanism, and then spend about 6 to 10 minutes on one syringe, and then she gets about 4 to 5 of these every feeding session. She's fed 3 times a day, morning, evening, and lunchtime. And then she gets water twice a day, kind of midday around 10 or so, and then again at about 5 o'clock in the evening. So take her time, do about 4 or 5 of these. Takes about an hour, maybe 45 minutes. And that's it. Just take your time. You can see she's kind of licking right now, which is kind of an indicator that she's going to get sick. So I kind of keep an eye on that, and if she is doing that, I'll either remove the tube and take her outside, or I can take the tube, lock it off with the yellow lock here, or the white lock, and you can tuck it underneath her shirt, just like that, and then she can jump up and run outside to get sick if she needs to. So when we finish Clover's food, the last tube, whether that's the 4th or 5th, clip off the lock here, take the last tube out, put it to the side, and then we'll go back and we'll put just another small syringe of water through to flush the tube out. Again, try not to rush it, not to give her an upset stomach or anything, but just flush out the tube one more time. And when we are all done, clip it one more time. Now this is mostly water in here with a little bit of food left. I will unlock and pull the feeding tube out. Try not to pull on her stomach. Then I will reclose the tube do one last quick little, just gently wipe it down, close her up, and that's it. Once she's done, let her kind of rest here on the couch to not upset her stomach, and then I'll fill the tubes back up from the food that's in her containers in the refrigerator, and then put them back in a Ziploc bag and do it again for her next meal. And that's it.